Hello everyone, I am Srishti Jain, counseling psychologist at TalktoAngel. Welcome back to our channel's Clinical Disorder Series episode 13. Today we have Dr. R.K. Suri, clinical psychologist with us to talk about somatic symptom disorders. Welcome sir. Sir, what are somatic symptom disorders and how are they diagnosed?
Thank you, Srishti. Somatic symptom disorders are characterized by excessive thinking, emotions or feelings and behavior related to somatization. There is a distress on account of such a feeling, emotion and thought. And the third cardinal principle is that the people who have somatic symptom disorder have excessive health concern about their symptoms. So invariably they go forward for regular checkups, which is different from OCD health checkups. Herein they are expressing that I have a pain at the back, I have a pain in the right hand, legs, etc., which keeps on changing.
Okay sir, my next question to you is how can somatic symptom disorders be differentiated from other mental health conditions with similar symptoms?
As I mentioned, your somatic symptom disorder is a mental health condition which gets impacted on account of preoccupations or excessive thinking, emotions and feeling about bodily distress, and as a result he or she go forward for regular health checkups. Now there are other similar disorders like I mentioned, OCD related to health issues, depression, anxiety, wherein also sometimes you find similar symptomatology. We need to have a clear-cut differentiation between them. And normally when the person goes there to the clinical setup or hospital, they are either underdiagnosed or they are overdiagnosed.
Sir, what are the common symptoms of somatic symptom disorder?
Symptom of somatic symptom disorder is excessive worry, hypervigilance about the disease and avoidance behavior. These are the cardinal principles or symptoms of a somatic symptom disorder.
What could be the common treatments for somatic symptom disorder?
See, as far as the treatment of somatic symptom disorder is concerned, the most common treatment is the psychotherapy, wherein we often go forward for cognitive behavioral therapy or dialectic behavioral therapy or accepted commitment therapy. And in addition to the therapies, at some time to provide a symptomatic relief to a patient, we often give the medication which are prescribed by a psychiatrist or general medical practitioner. Now, another important element in terms of the treatment of somatic symptom disorder is change in the lifestyle, self-care, self-management, and the practice of mindfulness, practice of relaxation, which often help a patient to overcome his symptomatic issues.
Sir, how can somatic symptom disorders affect daily life and relationships?
See, when it comes to the impact on daily life, when the person is having a too much hypervigilance, worry, excessive worry with reference to bodily features, bodily pains, he or she is not taking the daily activity to a level which he or she has to take. As a result, his lifestyle, his functionality, his performance at a workplace, his performance in academia if he's a student or teacher gets impacted. Similarly, if he is a son or a daughter, again his relationship gets impacted because people often misconceive this as a कि ये बहाने मारता है, ये नाटक करता है, ये नाटक करती है. So all those things are predominantly expressed against an individual, which further impacts his self-esteem, self-concept and self-image. As a result, he ends up into a bad relations with his partner or with his family member.
Rightly said, sir. What strategies can help manage somatic symptom disorders?
The strategies to be taken up, I have already expressed that the self-care is one of the best strategy which a person suffering from somatic symptom disorder has to follow. It could be a stress reduction process like mindfulness, practicing yoga, going forward for Zumba or aerobic, and any other activities. Beside this, the patient or the concerned individual whosoever is having an issue must consult a clinical psychologist or psychologist and a psychiatrist, and if prescribed medication, must take the medication on a regular basis and also get himself or herself diagnosed properly. If there is a comorbidity, that comorbidity needs to be taken up strongly. Further, he or she also needs to get a regular follow-up, regular therapies, regular medication. I would suggest, if you or any one of your family member is having a too much excessive concern about somatic symptom, he or she should consult clinical psychologist or psychiatrist or psychologist at TalktoAngel, an online platform which is there to provide support to you 24/7. Thank you very much.
Thank you, Dr. Suri. Thank you for sharing your valuable insight on this topic. We will see you in next episode.
Thank you.